So its legs are sort of pointing at a sort of 11 o'clock position there. It is moving about. That's not me moving, that's the foal moving about. Let's see if we can get a heartbeat. Oops, there we go, it's moving around. So that's one leg coming off. And then that's the bladder, that's the urine in the bladder, that's dark there. Got the legs again there. And there's the heartbeat. Just there. It keeps moving, so it's difficult to keep it in the same position. You can see the diaphragm, the line between the liver and the lungs there. And I can see ribs at the bottom. And gas in the stomach there. Difficult to keep it in one place because it's moving around so much, sort of constantly moving. And there's the heart beating in the chest. There we go. That's a nice picture of the heartbeat. So you can see the ribs there and the chest here and the heartbeat. And this is liver here, and I can actually see the blood flow through some of the blood vessels within the liver. So there's a nice clear picture of the heartbeat, and that's a regular rhythm. That's the rate I would normally expect. And then this is the neck. You can see the spinal vertebrae in the neck. And if I come out again a bit, just sort of off the bottom of the screen really, the head, I'm not sure you're going to get a clear picture of the head. I can go on to a greater depth, but we lose a little bit of clarity then. But this is the foal's head. I could just see the jaw bones there.
So we've kind of zoomed out a bit there, or zoomed in?
We've zoomed out a bit.
Out.
It's actually moved a little bit so we can see the heartbeat a little bit clear. I'm just going to zoom in a bit. It just goes on greater depth.
Yeah.
So there's the heartbeat. So let me have a look at the back end and see if we can see if it's in a position at all to be able to get an indication of the sex. So what I'm looking for is the hips and the so-called genital tubercle, which is the precursor of the genital organs, and they should either be in line for a filly or in a triangle for a colt, but it's just very difficult to get a clear image of that area at the moment. I think these are the hips and the femurs of the hind legs, but at the moment I can't pick up the genital tubercle. Moving about again. That's moving further forward again. We can see the diaphragm and the liver and the stomach, gas in the stomach. So moving further back again. See it moving around again there, and the membranes floating around. So this is the area here that I'm looking at with the hips. In terms of determining the sex, it does very much depend on the position that they're laid in and the clarity of the image, and I am struggling a little bit. Sometimes they're just in a perfect position and it's really nice and you can see it really clearly, but this one I am just struggling. That I think is one hip there, but it's a case of getting both hips in a line and then being able to see the genital tubercle. I mean, I think that's possibly the other hip, so that's probably one hip, that's the other hip, and this here is possibly the genital tubercle. She's just moving around.
So it looks further forward.
So that looked more of a triangular shape than a line, but very difficult to be accurate.
So if it's a triangle, it's a boy, and if it's in line, it's a girl.
That's it. Yeah, that's pretty much the principle of it. Yeah.
It did look a bit like a triangle.
It looked more triangular, didn't it? But I think, I'm not sure if this is one hip here. I can't get them just in the right plane. I mean, obviously we've got a three-dimensional foal in there, and we're looking at it in 2D on the screen, so we're looking at it through certain planes, and I'm trying to move the scanner head around a little bit just to get a slightly different angle on it to see if we can get them all in line and see both hips together, but at the moment it's just not in the right position for me to be able to do that. I think that's one leg, one hind leg coming off here, so this is going back to the hip area. But it is, I'm very, very much at the tip of my fingers as well. It's all a long way in.
Gosh.
So
So it starts to move.
Possibly a colt, but I really wouldn't like to be
Yeah.
certain on that by any means.
Well,
But we've got a live
yeah,
foal in there, we've
it's
got a
doing
clear
well.
heartbeat, everything looks normal.
That's
You know,
what we
size
want.
and shape is what we expect for this stage. And we can see again at the bottom there the heart beating away. You can actually see the valves within the heart opening and closing there, and everything looks good. And the fluid's nice and clear and black. This is part of the umbilical cord. You can see it sort of wobbling about there, and most of the foal, the head and things are just off the bottom of the screen there.
Gosh, because last time